testosterone is actually a very important hormone for sex drive. Not as important for women. Our hormonal symphony is a little bit more complex, and often women with low sex drive don't have low testosterone. And if they do, replacing the testosterone alone doesn't usually help. But for men, it's a little bit more important. So statin drugs may affect men a little bit more than women in terms of testosterone, but it also affects women in terms of lowering their estrogen, progesterone, DHEA, cortisol, and testosterone. It's a little bit more complicated in women, but nonetheless, the statin drugs can affect them just as significantly as it can men. Men will have an easier time treating the low libido from the statin drug than women will because, in women there's a lot more involved. Nonetheless, it can be corrected. And of course, as always, I would recommend that you look at the underlying root causes of the high cholesterol so that you can treat those naturally, so that you can get off of cholesterol-lowering drugs, so that you don't have that impact on your health. In fact, there are some studies to show that if you lower cholesterol too much, you have an increased risk of death. And so, again, that brings to light the importance of hormone production for normal body function. And when we abnormally lower our hormone levels, we can have some significant adverse events or even death occur from that. So, again, looking at the underlying causes of the high cholesterol is critical. And talking to your doctor about changing medications or looking at alternatives if your sex drive is being negatively impacted by these statin drugs. Some other causes, looking at medications, we talked about antidepressants, antipsychotics, cholesterol-lowering drugs, birth control pills. Those are the main classes of drugs that can cause a significant problem. Also, medical diseases can cause a significant problem with sex drive, especially diseases that affect blood flow. So we see with heart disease, we see with diabetes, cancer affects blood flow, high blood pressure can affect blood flow. All of those conditions can cause a low libido. They can cause vaginal dryness in women, erectile dysfunction in men, as well as low arousal. And so looking at the underlying causes of those conditions is critically important in order to work on improving blood flow, improving metabolism, removing toxins from the body. All of these things are critically important in order to recover libido from diseases that are known to cause a low sex drive. So that's critically important. And not only that, but it just makes you healthier overall, prevents other diseases from spiraling into the picture, so to speak. And it prevents death from those diseases as well, to look at their underlying causes. And in our third segment, we'll be talking about how do we look at those underlying causes and how do we naturally and safely improve libido, and I'll be giving you my 3 tips for that at the end, towards the end of our show. Lifestyle habits are also a cause of low libido in many people. So alcohol and smoking, cigarettes, are probably the 2 most obvious lifestyle causes of low libido. Alcohol in excessive amounts. So if you have a glass of wine, you're probably not going to feel the impact. But if you have multiple glasses of wine or other alcoholic beverages, you're going to see likely that your libido is not as vigorous and normal as it is when you don't drink in those amounts. So definitely alcohol has been linked to affecting sex drive, and cigarette smoking for the same reason as the diseases we just talked about. Cigarette smoking impacts and constricts blood vessels, so it closes the blood vessels down. And that clearly will impede the flow of blood, and that will lower sex drive. It can cause also vaginal dryness Smoking is very drying because it's a lot of heat going into the body, a lot of toxins going into the body, and it constricts blood vessels. And so all those things kind of collide into all of the predisposing factors that would drive libido down. Fatigue. We kind of talked about fatigue, but fatigue is a definite cause of low libido because your libido is simply your extra energy. So if you're feeling tired already, you're not going to have that extra energy, so to speak, in order to have a healthy sex drive and healthy arousal and response. Surgery as well. So for those who've had surgery in the genital tract area, so for example, if you had a baby and you had an episiotomy, which is where we make an incision in the muscles just above the anus, just to allow more room for the baby to come through the birth canal, and then we have to repair that. So we will suture it back together, and there can be scarring from that, and there can be reduced blood flow from that, which can cause vaginal dryness and discomfort, leading to low libido. So surgeries that you have in the genital tract. Some women have had prolapse surgeries, where those are hernias that occur in the vaginal tissue, allowing the bowels to kind of cave into the vagina a little bit, or the bladder to cave into the vagina a little bit. So women who've had those surgically repaired can also experience low libido, sometimes from pain from the scarring or vaginal dryness. These types of hernias or prolapses are often driven by diminished blood flow to the vaginal area, as well as diminished hormone production in that area as well. And so those two things combined can certainly lower libido. So that takes care of most of the causes. One more in reproductive age women, so breastfeeding. Breastfeeding sometimes will cause a low libido because, especially in women who, according to traditional Chinese medicine, might be blood deficient. Millions of women are probably blood deficient and don't quite know. But breast milk uses up blood, as does a pregnancy, as does menstruation before the pregnancy. And so many women are blood deficient for that reason. In particular, if they're not resting enough, if their diets are not supplying them with enough blood-rich food, green leafy vegetables, and meat products. If they're not eating those in adequate proportions to keep up with the demands of their blood, they will become blood deficient. So sometimes this also manifests in lower breast milk production, but it can also manifest as significant vaginal dryness. And there can also be some alterations of hormone production during breastfeeding that can lead to lower sex drive. And then there's also body image with women who have just delivered babies. So frequently, I'll hear that they don't like their bodies after they've delivered, and they want to get their, pre-pregnancy body back. So all these things are factors in lowering sex drive. And then, of course, there are the psychological causes, depression, anxiety, or just good old-fashioned stress. Chronic stress lowers hormones. It will suppress hormone production. And hormones are critically important for sex drive, as is nutrition. So all of those things can come together to cause a low libido. So those are things that are important to look at as well. And then there are relationship issues that can lead to low sex drive. So if there's any unresolved conflicts between the partners, if there is if there are some trust issues, there's not enough of a foundation laid in the relationship, that can impact libido and sex drive. Poor communication is a definite cause of low sex drive. Again, these are mostly psychological, but nonetheless probably even more important than the physical causes. So these are all some of the causes of low libido that you always want to look at and talk to your physician about, talk to your therapist about, or your healer, and make sure that you cover each and every one of those potential causes in order to really come up with a very comprehensive treatment plan. So when someone comes into the Ryobe Institute, we use traditional Chinese medicine to diagnose the underlying causes of low libido, so that we know from a physiological and energy standpoint what it is that's causing the low sex drive. So in traditional Chinese medicine, what we call yang deficiency or blood deficiency, those are probably the two main patterns of disharmony, if you will, that cause low libido. Sometimes they are combined with other patterns, so we have to know those as well and treat all of the different patterns to have a successful treatment. So oftentimes when we check their tongue, if they have a yang deficiency, we'll see that their tongue is pale. They may have kind of a glassy coating that might be a little bit wet. Their tongue might be a little bit thinner than usual. And when we check their pulses, they might be deep into the body and weak. And these are all signs of a yang deficiency. And then the client may relate that they feel cold, like they literally feel cold all the time. Excuse me. So that's how we would diagnose a yang deficiency. If they had a blood deficiency, their tongue might be pale as well and a little bit thin, maybe a little bit dry. And when we check their pulses, it would be kind of thin and weak. They might relate feeling a little bit dizzy every now and again. They might relate fatigue. They might relate kind of like floaters. They relate floaters in their vision. These are all blood deficiency signs. So that's what they might tell you in addition to the low libido that will help you to figure out exactly what you're dealing with in terms of the pattern of disharmony. And then we would treat accordingly with herbs or acupuncture, which are very, very successful to treat low libido. And then we would also look at the psychological and spiritual aspects as well, so that everything kind of meets in the middle. So we're getting ready for our next commercial break, and when we come back, we'll talk about other natural and safe treatment options for boosting libido. And I'd love to hear from you. So I know you're out there wanting to ask some questions, so please feel free. My number is 833-220-1200. We're right here on Dream Vision 7 Radio. And when we come back, we'll talk about natural and safe options to boost libido right here on Awakened Wellness with Milen Ryobe, MD. Thank you.
What happens when we begin to realize that the 200-year experiment we've called the American healthcare system has failed? Learn how spirituality, ancient traditions, and cutting-edge science are merging to create a new paradigm of wellness on Awakened Wellness with Milen Ryobe, MD. Tune in every Tuesday at 11 a.m. and 11 p.m. Eastern Time with live shows on the first and third mornings when you can call in and ask Dr. Milen the questions that matter most to you. Dr. Milen is the medical director of the Ryobe Institute of Integrative Medicine in Jupiter, Florida. For more information, visit ryobeintegrativemedicine.com. Dream Vision 7 Radio Network invites you in for this dynamic, forward-thinking show.
Looking for a fun and relaxing getaway? Omega Rest and Rejuvenation Retreats are a great way to unwind and renew your spirit. Stroll through the garden, relax by the lake, or try a daily yoga or movement class. You can stretch your body, quiet your mind, and do as much or as little as you choose. Located in Rhinebeck, New York, just 90 miles north of New York City, Omega's natural environment and quiet pace allow for extraordinary experiences to unfold. Learn more at eomega.org.
This